Hi everyone, I'm Dr. Priya and welcome back to my channel. So, are you a dental student, an undergraduate, a recent pass out, or an intern who's interested in clinical dentistry but who's constantly bothered about post graduation? You aren't sure if you want to pursue a post graduation or if you wish to pursue a post graduation, you aren't sure which department should you choose, or are you constantly battling the thought of if a post graduation is necessary to start a clinical practice in dentistry? Well, in that case, you're in luck because today we are talking to Dr. Priya Titus Singh, who is a dentist who is based out of Navi Mumbai. She runs a phenomenal and a very cutting edge advanced clinical practice. And not just that, she's an educator, she's a phenomenal dancer who's trained in Bharatanatyam. She's constantly running counseling sessions for students, and she's also running courses pertaining to aesthetic dentistry, dental photography, implantology at her own center at Mumbai. So, what we are going to discuss with Dr. Priya today is entirely about if a post graduation is required to set up a clinical practice, if you need a foundation in the form of an MDS to start a clinical practice, and we'll also understand Dr. Priya's journey, right? We'll understand how she niched down to aesthetic dentistry. How is it that she understood that this was her calling? We'll also talk about how she has worked at certain very renowned clinical centers, how she's practiced under certain very renowned dentists, and she did that for a good period of 2 years, and that's when she decided that she needs to start a practice of her own. So when you watch this video, you'll understand the entire journey that you need to take so that you understand what it is that it takes to run a successful dental practice, because that is something I feel is not spoken about a lot, right? So please do go ahead and enjoy this video. There's a lot of learning that's coming out of this. If you wish to connect with Dr. Priya at some point, I will be leaving her contact details in the description box, and if you have any questions for me or her, I will have my mailing ID linked down in the description box. So please do give it a thumbs up if you did enjoy the video. Share it with your friends. I'm sure this will help so many people. It will solve so many doubts and it will answer so many questions that a lot of you all have. And yeah, I really hope you take something away from this video. So let's not waste any more time and let's just get started with it. So welcome to the channel, Dr. Priya. It's so good to have you on board. And like I do with all of my sessions, so we'll first talk about you, and then we'll slowly move to what it is that you're doing right now. So do tell us a little bit about yourself, a brief introduction maybe.
Uh, I am Dr. Priya Titus Singh. Hi, everybody. I am a general dentist. I have a special interest in aesthetic dentistry, and I have been in practice for the last 11 years. Um, Aesthetic dentistry has been a calling right from the beginning. There was no scope for me to ever do a master's because India did not have a master's program. But in those 10, 11 years, it was a constant effort to keep updating and keep learning more and more about aesthetic dentistry. And that's how now I have my own practice, which is mainly aesthetics. And of course, we do all kinds of, we do general dentistry. We have consultants who come in for every other work. And what else can I say about myself? I have a 2-year-old child. So it's right now part-time dentist and full-time mom. That's my bio, so to say.
No, I
and
understand it's a difficult work because I connect with you over there. Having a 2-year-old kid is tough, and you have to be hands-on. I'm actually very thankful to my in-laws, so they really help me out, which is why I'm able to work. But I'm sure it must be very difficult for you as well. But this is how you're motivating and inspiring to a lot of uh, girl students who are going to be listening to this, because people feel like once you're married and then you have kids, so your career is going to take a backseat. But I don't think that's necessarily the case. If you are motivated enough, you will find a way to get back on your feet, isn't it?
very true, very true.
So we will come to this eventually, but let's just start from did you always want to become a doctor growing up?
Yes, I did. I did. I actually have a very strong core memory, I would say. I was probably 5 or 6 years old and I had gone to the pediatrician. My mom had taken me to the pediatrician and he had asked me, "Bacha, kya banna hai bade hoke?" And I was like, "मैं तो मम्मी की तरह डॉक्टर बनूंगी." So
Okay.
I still remember that. I still remember that I had told my pediatrician that I want to be a doctor at that young age.
Oh, that's fantastic. So you come from a family of doctors, I'm presuming then?
Just one doctor. My mom is a doctor, that's it. And she's a homeopath. She's got her own practice. So growing up having that role model that, mom goes to work, that was always there. And I wanted to be a doctor because I saw the kind of work she was doing. I saw the difference she made in people's lives. And somewhere I think I wanted to do that as well.
And I feel like working moms have that power, unknowingly they will put you into that phase wherein you start getting inspired by them. You start looking up to them that, okay, wow, so that's the new normal, when they are doing it, you feel like you obviously have to do it. You can't not do it, right? I resonate again with you over there. My mom was not a doctor, but she's been a teacher and she's been working throughout. So that's something that was as normal for me, that women have to work. There's no if and
Yeah,
but
yeah.
about
When friends used to say my mom doesn't work and she's a homemaker, that used to be weird for me because for me, normal was mom going to work and dad going to work. So that's the difference there.
That's fantastic. That's really good. So, how was your experience in dental school, like 5 years over there?
It was awesome. It was awesome. I really enjoyed my college years. I think since that bachpan se tha na doctor banna hai, there was a lot of focus in studies during school. So I think my memories of school are pretty skewed because I think I only remember padhai, padhai, padhai. I don't remember much about anything else. But college was a time when I think some amount of independence came in, and really enjoyed doing everything, being a part of the whole thing. And I was so involved in cultural activities, and of course the curriculum, the teachers, everything was fun. I think we have made friends for life, so close. All of my batchmates who were in internship with me, we are so close even today, and coincidentally we all have children around the same age, so that makes a huge bonding factor, so to say.
And it's so important because I feel these are the friends that will last you a lifetime. They're also going to be your backbone. You can jump on them. You can ask them for advice right at 1 p.m. at night, or, whichever hour. Yeah, I agree with you on that totally. And I
3
also,
a.m. The 3 a.m. friends, they are all from there.
yeah, I think they're all from dental school because you go through those 5 years, and that's also when you're developing your own mindset and yourself. So fantastic. Yeah. So were you in hostel at the time?
No, no, I wasn't. I was a localite, but yeah, I spent a lot of time studying in the library. Did not go home and study because my sisters were quite young. So, घर पे जाके पढ़ाई नहीं होती थी. हम लोग सब साथ में कॉलेज में बैठ के ग्रुप स्टडी करते थे. So that
Oh,
also was a huge thing.
wow. And पढ़ाई की बात करते करते, would you tell us about the prestigious Tata scholarships that you've received also, if you could put some light on that?
So Tata used to have a scholarship. I'm not sure if they still have it, but they used to have this scholarship, which was essentially financial assistance to deserving students. So you would apply for it. You had to give reports of your parents' income tax returns. So that gives an idea of what kind of financial background you are coming from. For me, I'm from a normal middle class family. Of course, both parents were working, but we took a loan. We took a loan so that I could study, and with basis of all that, in the application, we got some amount of a scholarship. So it's always good when such kind of incentives are possible because it does take the load off a little bit, from the. It's a huge investment. Dental school has always been a huge investment, and if you are able to get that aid a little bit, it makes a huge difference.
Yes, it does. And so once you were done with your internship, so what was your mindset then? Did you want to at all pursue an MDS? Were you even thinking about it? Because I remember you are around the time when, even I was doing my internship. So there was a lot of people who would think an MDS is required. So was there any peer pressure at all? And how did you overcome that? And how did you go on after that?
Not really peer pressure, but it was just something that was a thought. I mean, karna hai kya was a question. And again, how much investment, like there are always those options, right? You have the government seats and you have the private seats. And are you really willing to put in that kind of finances into a private seat? That was a big question. Government mein to the reservation and with the number of open category seats is very limited. So and we also understand where we come from, right? We know our own limitations. So I was not very confident कि government में मिल जाएगा. And at that point it was like agar government में मिला तो ले लेंगे नहीं तो नहीं लेंगे. It was like that. And of course in the meanwhile I also started working. So I worked and I realized that okay, for a roaring practice like this also, it's not that an MDS is required. I mean, an MDS gives you a good um, holding to a particular subject, like you understand one subject in depth for 3 years, but essentially you also lose out on other things. You kind
Yeah.
of stop being a general dentist at that point, and you look at everything through the specialty that you have learnt. So I realized that that would be probably a limitation to some extent, and I was not very keen on doing that. And ऐसे ही हुआ, CET में marks नहीं मिले for getting the PG seat also in a government setup, and private में I did not want to put in that much money. So because dentistry again, you have to put in money all over again when you start the practice, right? So did not want to do that. So that's what gave us the decision that ठीक है MDS नहीं करना है.
And so what did you do after that? You just told us that you started working. So you started working in somebody else's clinic then, or did you start your own practice?
No, no. See, the thing is, the syllabus that we have right now, it has not managed to update itself to an extent where they can provide you enough training for private practice. What you learn is very basic when you come out, and if you have to be updated with the current dentistry which is going on, you need to be able to update your skill. So people, I actually feel sorry for people who immediately graduate and start a clinic, because actually you don't know anything. एंड वो पॉइंट पे यू आर लाइक लॉस्ट कि अरे कॉलेज में तो हमने लैटरल कंडेंसेशन सीखा था फॉर एंडो फॉर एग्जांपल, एंड यहाँ तो सब लोग बैकफिल कर रहे हैं. बैकफिल की मशीन कैसे चलानी है मुझे ये भी नहीं पता. समथिंग एज सिंपल एज दैट. और रोटरी एंडोडोंटिक्स फॉर एग्जांपल, कॉलेज में हमने हैंड फाइलिंग किया है, जबकि हम प्राइवेट में रोटरी यूज़ कर रहे हैं. सो द डिफरेंस इज ह्यूज. There are very few fields, I would say, departments, so to say, in dentistry itself, where we've been doing essentially the same thing for all these years. Extractions is one thing, disimpaction, extraction surgery, that really has not changed much from what we learned in college versus what we are doing right now. But most of the other things are so technology dependent that things have really changed quite a lot. So unless and until you have that, you go to a private practice and get exposed to all that, you don't realize कि हमें क्या क्या और सीखना है, what all we need to learn more. So that was a big deal for me when I went into a private practice, and I figured out that okay, there are a lot of things here which I really need to learn, and उसके बिना तो practice खोल ही नहीं पाएंगे. So I probably worked for uh, 2011 to 13. So that's 2 years. Within 2 years, I opened my own practice, and I also had a job going on at the same time. So it was parallel. Like morning, I used to work for somebody, and evening, I used to be my own thing. I used to do my own thing that way.
That's so good. I think that's important, to have that hands-on experience at somebody else's place who's running a good practice by himself, because that is a different learning curve altogether. Because, like you said, what we teach in dental schools is very different from what you actually end up doing in private practice. The entire patient psychology, how you end up talking to patients, that's an art by itself, is what I feel. It's very different, and of course, from how you're going to do what things agreed. So, coming next to aesthetic dentistry, so how did you get an inclination there?
So the practice I worked for, Dr. Indraneel and Dr. Komal Majumdar, they are amongst the most biggest practices in Navi Mumbai. And I was very lucky to join them when they expanded from 5 chairs to 10 chairs. They have 10 dental chairs in their practice. And I was one of the doctors who they employed at that point. And the place has always been a inspiration. Even today it is. They do the most cutting edge work, the most up to date dentistry. So when I entered there, and I realized that okay, there's a lot of work happening which was never taught to us in college. So now we need to learn. We need to learn more, and we need to learn about restorative dentistry, and we need to learn about aesthetic dentistry. And of course, it caught my eye because you like that immediate happiness that the patient shows you at the end of the procedure. You see that big smile coming in, and the confidence coming into the patient's eyes, and that was like instant. I was like, oh wow, this is what I want to do for the rest of my life. So it went up from there. I mean, the interest cap got in there in 2011 itself, and then from there it has just been growing.
Right. And fantastic. So you worked with some very brilliant people. Dr. Komal Majumdar, I think, is a brand in herself. And clearly she's radiated her energy on you. And fantastic. That's really good. And so did you take up any special courses for aesthetic dentistry then? You did.
So many, so many.
And you do believe that upskilling is important, isn't it? Because you have to constantly keep learning. So you've trained in India also, and you've done a few courses from abroad as well, right? And now you're running your own courses and training students about the same. Could you tell us a bit about that? Because I am sure there's so many students who are looking out for such courses. Aesthetic dentistry has always been on a high, and I feel now people are realizing it even more, especially because dental photography and that whole video making, I remember it's so mesmerizing to see that whole transformation of a patient.
Yes.
So, and you've done a course on that too. So if you could speak about this and tell us.
Okay, so in 2011, when I started learning, there were very few teachers who were teaching, workshops, who were taking workshops for aesthetic dentistry as a whole. It was more of, one technique, composite सीख लिया, laminate सीख लिया, rubber dam सीख लिया, ऐसे separate बहुत सारे topics हुआ करते थे. There was not like one single full integrated course which covers start to finish of aesthetic dentistry. So that itself has been like a journey. Uh, I went for multiple courses all over India. In fact, there was a time when I was hardly earning anything, but I used to save that money and go for the conference. Flight ticket खरीदो, रहने के लिए जगह देखो, and go pay the conference fee. And they used to have these very nice one whole day pre-conference courses. So you would get to learn one whole material, hands-on, learn how to manipulate that, see the lectures and see the literature behind it and everything. So it was very enlightening. And my parents used to wonder, ये पैसा कमाना कब शुरू करेगी, because it was all the time खर्चा खर्चा खर्चा. It was always expensive. So, but they had the faith. They had the faith in me that okay, I am building up my skill and eventually it will pay off. So that's exactly what happened. And photography, yes. With today's world of Instagram, I mean, हम लोग जब college में थे तब Insta नहीं था. तभी it was more of Orkut and Facebook. So subsequently, this WhatsApp and Instagram and now Snapchat and all of these have come so into the play that I think even youngsters who are fresh pass outs, dentistry, fresh graduates, they know what kind of dentistry is happening overseas. They see these brilliant practitioners who are doing such a great job, and they realize that they need to up their game essentially. So photography helps us with that. And for me, I feel the biggest advantage has been that I get to document my cases. I get to see my mistakes. I get to see where I could have done something better, same din pe, after that full harrowing work, at the end of it, maybe you may not have the mental space to understand that you could have done better. But subsequently, maybe the next day after you had a good rest, and you again look back at those pictures and you're like, okay, this could have been better. I could have worked on this a little more. And now, here, if the patient has the faith in you and they are willing to give you another chance, you can always call them back and do a few corrections here and there, especially in composites. Composites are very forgiving. So you can do that. And I think photography really helped for me to improve my work. And that's what I feel everybody should do. In our curriculum, mostly the people who do document their cases are postgraduates. The UG people do not really document their cases even today. So this is something which I hope will change eventually in time, where everybody takes pictures of the work that they are doing, and they basically understand where they're going wrong. They basically understand how they could do better, and keep upping the bar of dentistry basically.
Yeah, I agree with you because all of these are skills that come in much later, and and I think it must have helped you a lot. Attending conferences is again something that we learn that we are supposed to do in our PG. I don't remember
Yeah.
attending any conference for that matter after I was done with my undergraduation. I felt like this was something only meant for PGs. Only they will go, and which is not the case. We have some fantastic conferences for undergraduates. So people should really use them. You can really learn a lot, and because you have that foundation, BDS gives you that much of knowledge that you can go attend, learn, and you can start implementing it one step after the other, right? So great. And what about the course that you're running at your practice?
So I have multiple courses again. I teach A to Z of aesthetic dentistry. So we have module-based anterior composites, posterior composites, inlays, onlays. That is your bonded partial restorations, veneers, rubber dam isolation, dental photography, bleaching, microabrasion, everything that you can think about in minimally invasive dentistry. We cover everything. We cover everything. And I have been teaching since 2017. So it's been 5 years now. And a lot of batches coming, going, and a lot of new advances that keep happening. Like we recently we started doing injection molding also in our composite workshops because that seems to be the future. So even we keep trying to change the systems that we are learning so that we can provide the best possible to our practitioners as well, to our clinicians as well who come to learn. And that's the goal. That's the goal. Spreading the knowledge is basically the goal.
That's so important. And just one more thing, how long are these courses that you're running?
Some of them are 2 day courses, like 2 day workshops. Some of them are long 6 months, and we have 2 days every month. Plus, we have a lot of homework. We have case presentations, and we have all that also. So it's different. I mean, both of them depending on where the participant is located. Like people from outside, they don't prefer coming back every month for a workshop. They would rather come for that one workshop, go back, attend, and maybe come back next year, something like that. So that also works out. We are flexible
So
that way. No rigidity over here.
that's great. That's great. So for anyone who's going to be interested, I'm going to link her number in my description box, and you can check out Dr. Priya's Facebook profile also and her number, and you can directly contact her, and she'll guide you further for this. Because I think aesthetic dentistry is truly, it has just started rolling out, right? It has a long way to go. And
Absolutely.
so, what does a usual day in your life look like? I'm sure you're busy, but so how does you work for how many hours?
So
When
you
do you
mean
come to
personal?
clinic? No, professional, professional. Personal, I'm sure you have no time at all left with you. Yeah. So professionally, what does it look like? Do you
So
take
right now
any days off at all?
yeah, of course. But as a mom, I don't think that you any really have a day off. I
Yeah.
mean, even the day off is like with the baby, so not really off. But okay,
That's when you're doing most of your work, isn't it?
yeah, absolutely. That's the most important work right now, isn't it?
Yeah. And so, you're running such a fantastic practice. You're teaching students, you're also doing wonderful patients, and you're documenting your journey. Do you think at this point in your life, an MDS or a post graduation at all is required to run a successful clinical practice for a doctor?
No, no, I
This is an
don't.
answer
I don't.
right there
Yeah.
for all the students
Great.
who are at all in a double mind. Sorry,
Okay,
sorry.
my point to people who are fresh graduates. Uh, for a few years, maybe 1 or 2 years, try to work under somebody and try to find out what part of dentistry you like. Okay, because dentistry is so vast. You have orthodontics, orthopedics, where you're really moving bone around. You have surgical work where you're cutting, right? You have fine surgical work like perioplastics, where you're doing almost plastic surgery level work. And then you have restorative dentistry where you're just restoring what's lost. So that could be composites, that could be indirect bonded partial restorations. So these 4 or 5 very separate fields are there. And of course, the awareness part where you have public health dentistry. So find your niche, find what you actually like to do. And after that, if you feel that you need to do a master's, you can definitely go ahead with a master's. Do not do a master's thinking that because I'm doing masters I will get paid more, because that doesn't happen. Okay, that does not happen. There is no such thing that a BDS person will not make money. A BDS can also make money if they train themselves in that one particular field that they really like, and they are passionate about the kind of work that they're doing, and that work makes them happy. I think
Yes.
that's a very important thing for anything that you do. It has to make you happy. Otherwise, every day that you go to work, it'll feel like work. Oh my God, I'm going to work. For me, it's not like that. I actually enjoy coming to work. I actually enjoy doing what I do. I think dentistry for me is meditative. I actually am the most calm and the most peaceful when I'm doing dentistry. So find that what makes you happy that way. And after that you can decide, like if you really love a subject, like for example, I do know people who love oral surgery so much that they only practice surgery, and that has been the case since the time that they graduated. That was the most favorite subject during UG, and they managed to push everything into it so that they could get that PG. The love of the subject, that is what forces them to do the masters, and that makes sense because then again you'll always be happy that it's come out nice, that you've done your masters in a subject that you really love. You will be happy to update in that. You'll be very happy to learn more about it, and keep going ahead from there. So don't look at a masters as a way for earning more money, because money is a very superficial reason for doing this. Rather than that, look for passion, look what makes you happy.
I think that's such an important point that you've made, look for what makes you happy and find your niche accordingly. I totally agree on this. And this is so important because now what I see happening is as soon as people finish BDS, they just want to jump into MDS. Now, no, I'm not blaming students for this, but I just want to make a point here that I think people should take the time to find what you really like, and there is going to be one particular area that you resonate most with. For some people, it's going to be ortho. And like you said, for oral surgery has a different division altogether. Like I've seen my husband and I've seen certain oral surgeons who are so passionate about it, they only want to do that and works well. I think such people should only pick up such subjects because, and same with prosthodontics, it's a very typical subject. So unless and until you have a liking for it, don't go ahead and do it because then, like you said, when you have to wake up every morning and when you have to go for work, you should be happy. If you're not happy, it's going to become a punishment very soon, isn't it?
Absolutely.
Yeah.
Yeah.
So that's great. That's great. And I think with this, you've also told us what are the certain qualities a student should be looking for within themselves while they are looking for a subject to do
Yeah.
their masters in, or if at all they don't want to do. I think general dentistry is also a fantastic field. You get to do so much, and there's so much work if you look at it like that. And
Yeah.
what are certain qualities you would highlight in a general practitioner? That these are certain qualities that you must have so that you can run a successful clinical practice.
Hmm. Okay, dentistry wise, we don't really get a lot of training as far as private practice is concerned. So work on that. Like simple things like what kind of a chair I should buy. If the chair breaks down, what can be done? What happens when your compressor doesn't work? If your aerator is not working, what can you actually do? So do all this homework before you actually start a practice. Practice wise, of course, you have all these fields of dentistry which are there, all the departments that you went through. But again, the syllabus was very limited. The syllabus was very oriented to probably 20 years ago. So again, updating over there, as soon as you're ready to open up a practice, maybe every 6 months go for a course. Do 6 months of, do at least one course, say in pediatrics, one in oral surgery, one in um, endo, one in prosto. I mean, little small stuff which is required for private practice as a general dentist, because our orientation when we are in college is very department like. Matlab, if you are in endo, you're doing only endo. If you are in prosto, you're doing only prosto. But when in your private practice, you will have a patient who will come to you with dental pain. You are going to do a root canal and then followed by that a crown. So crown or a partial, whatever. So over there, unless you have these skills, you're not going to be able to work very efficiently. So that is one thing. The second thing is, at least you should be able to diagnose the problems. If you're able to do the treatment yourself, great, okay. But if you can't, at least you should know what you can tell your patient, what can be done, and then you have a consultant on call who can come and do it for them.
Right.
So that way you're always delivering the best possible work for your patient. It's not even if my skill is limited, like I don't do pediatric dentistry at all, okay. But now because I have a son, I know I have to take care of his teeth, so I'm now brushing up on my pediatrics. So that's how it is. I mean, even if I didn't have the skill, I should at least know that okay, this could happen, this could go wrong, this could be done. And if I'm not able to do it, I will call a pediatrician to do it, that way, a pediatric dentist to do it. So that is something which everybody should work.
And calling for consultations, I think, is so important. I see this shift happening now. People are more open towards calling consultants, and I think that's so fantastic. This mindset is changing, and it's good to see this happen. I also
Yeah.
liked how you said, every 6 months you must attend a conference. It's easier for somebody who's done an MDS because we do have conferences and conventions, so we by force have to attend them. Let me just put it that way. But for somebody
Yeah.
who's not planning to do a master's, I think it's very important to look out for these conferences where you can upskill, because otherwise you're going to miss out on so many important developments, and that is going to show up in practice. So terrific points made right there. And I also know that you are a trained Bharatanatyam dancer and you've got a degree there also. And this is somewhere I connect with you once again. Although I don't have a degree, but I've trained myself. I was a trained Bharatanatyam dancer myself. So this is your passion, and I know you do perform also. How important do you think a side hobby or a hobby is for professionals, especially?
Very important. There is something which you have to do which is not really bread and butter, but it is something which really enlightens your soul. Like it totally brightens up your day. Like the days I go to dance class, I'm like the happiest that I could be. When I'm performing, when I'm dancing, I'm really happy. I've been a dancer longer than I've been a dentist, so that's also there. Yeah, and I think that's very important that you find some one hobby which is mentally stimulating as well as physically keeps you active. I think dentists, because of our long hours of working, with the posture that we work, we don't really pay attention to ergonomics. With all of that, if we don't really take care of uh, our bodies would give up eventually. So even if you have a mindset that, okay, I'll retire at 60, if you start having back problems by the time you're 40, or you need a surgery by the time you're 40, it doesn't make sense. You will not be able to actually work that long. So taking care of your body at that point, making sure that your back, your neck, everything stays stable so that you can continue working for a long time. That's very important. And I learned this the hard way. Despite being a Bharatanatyam dancer, I have shoulder pains, I have wrist tendonitis. This has come after pregnancy. So I have learned it the hard way that we don't really prioritize ourselves, we don't take care of our bodies as much as we should. When I went abroad overseas to learn aesthetic dentistry, I saw that people are so particular about the timings that they work, and they're so particular about the timings that they give for their hobbies. Like one of my friends now is a very good surfer. She surfs literally 3 days a week. She works 4 days a week and she surfs 3 days a week. And it's amazing. The balance that she's found in her professional and her personal life is amazing. Of course, in India, the kind of population we have, the kind of patients we see, it may not be so easy to work 4 days and rest 3 days. That's not going to be possible. But at least taking some inspiration from that, if we can put in some amount of time taking care of our own bodies, doing some yoga, doing some gymming, some swimming, some kind of an activity which keeps you physically very fit. This is something which is very required.
It is, it is. And I'm so glad you mentioned it because, I feel like this is something that we give up on the fastest. And this is
Yeah.
the first thing that just goes off your list, isn't that? इसके लिए तो time नहीं है. But I think personal care is something that is very underlooked and very underrated, but it's the most important. You've got to find that me time. It will recharge you in a manner that you do not know. And so of all these people that I've spoken to, everybody agrees to this. And I'm so happy that every time I speak to somebody, they all tell me that yes, a hobby is a must and everyone has one. So yes, for anybody watching, please stick to your hobbies. They're going to really make a remarkable improvement in your life. So it was wonderful to have you, Dr. Priya. Any parting words that you'd like to tell any of the audiences who are watching you, and what are your future plans looking like?
Okay. Parting words. Take care of your mental health. Everybody, take care of your mental health, because dentistry or owning any business actually is a very difficult thing to do. It's not something which we learn. The financials of it, the running of it, where you're coordinating between your help, your dental assistants, your locums, your people who take care of your machines, the technicians in the lab, the material guys that you work with, where you're ordering material when your stock is getting over. So there is a lot that goes into running a business, a lot that goes into running a dental practice. And a lot of this is very taxing on everybody. Trust me, everybody is facing the same thing. uh, when I opened a practice, I was so scared. I was not very sure if I'd be able to do it. I was so scared that maybe the location I have chosen for my clinic is very wrong. uh, there were so many thousand thoughts that came and went. And then at the end of the month, how much money have I made? Am I in profit? Am I in red? In fact, in dentistry, you invest first and then the returns come much later. So please give yourself that grace. Take care of your mental health. Give yourself that grace that it is tough. Okay, it is definitely tough, but you need to stick around. You need to give it your best. You need to not give up. This is something which is very important. On a daily basis or probably weekly basis, I speak to some a graduate student, a BDS student who reaches out asking for what can be done ahead. Are we on the right path? Because people are so confused about what to do further, after BDS. Which is why I think Dr. Ipsita, you're doing a great job. You're actually doing such a great job keeping these videos and helping these guys to see it and not just right now. Most of these points are going to be relevant even in the future. So even later when people check it out on YouTube, it's going to be such a great service for all of them. So big kudos to you also for doing this.
Thank you so
You know,
much.
one,
I'm so glad that I'm able to have conversations with you people. The entire reason why I'm doing this one is because when I tell somebody's story, of course, it remains me telling somebody. But when somebody is telling their story, their narrative by themselves, it makes you more authentic. And I'm sure so
absolutely.
many people would be able to connect with you. So dentistry is a fantastic field, and I want it to remain like that. And people like you are doing such amazing jobs. I mean, people need to check out her page, and you should see the photographs that she has and the courses that she's running. And I think once somebody has scrolled through your page, that's motivation enough. And then talking to you is another thing. So yeah, I'm so glad that there are such people doing such wonderful work. And I'm doing my tiny bit, and I'm very happy that I'm doing this. Actually, it's giving me so much joy. So yeah, thank you so much, Dr. Priya. It was fantastic to talk to you. And